Welcome to Connective Care Education.
Today we are going to look at Unit 003, Learning Outcome 4, Pressure Area Care. Pressure area care, pressure damage and pressure ulcers. Pressure ulcers are areas of the skin and underlying tissue that are sore or damaged as a result of constant pressure or friction. Pressure ulcers develop when pressure or friction is applied to the skin and underlying soft tissue closes or damages capillary, venous or lymphatic networks. Cells around closed vessels die and cause damage. Bony areas of the body are more susceptible to pressure damage. Eventually, this can lead to deep tissue damage and necrosis. Pressure ulcers can have a negative impact on an individual's quality of life. Neglecting a pressure ulcer can cause infection, severe pain, and the need for surgery. Pressure damage is caused by low pressure and immobility, for example, lying in bed or sitting in a chair for a long period of time. High pressure or pressure from equipment being used, such as heart monitors. With good pressure area care, most pressure ulcers can be avoided. This can be by changes of position, checking skin for signs of ulcers, a healthy balanced diet, and not smoking. Risk assessments by the healthcare team reduce the occurrence of pressure ulcers. Legislation and national guidelines in relation to pressure damage. There are pieces of legislation and guidelines in place to ensure that individuals involved in the care of vulnerable adults and children know how to minimise the risk of pressure damage and how to treat the damage if it does occur. NHS Wales Health and Care Standards, Standard 2.2, Preventing Pressure and Tissue Damage. This standard is about minimising the risk of people developing avoidable pressure ulcers. Pressure ulcers are one of the most frequently reported adult inpatient forms of clinical harm. An assessment of the range of factors which are known to increase risk of developing pressure ulcers is important in developing a plan of care which aims to minimise the risk of individuals developing pressure ulcers. Pressure Ulcer Reporting and Investigation All Wales Guidance 2018. This document promotes consistency and guides performance reporting against Welsh Government targets for zero tolerance to pressure damage. It provides guidance on when pressure damage should be considered for referral into safeguarding processes. It facilitates effective learning through the development of a standardised investigation process to reduce the risk of further patients suffering the same harm. Essential elements of pressure ulcer prevention and management. This guideline facilitates the introduction of and adherence to clinical guidelines that outline optimal strategies for the prevention and treatment of pressure ulcers through its introduction into local policies and guidelines and evidence-based care planning. NICE Guidelines. This guideline covers risk assessment, prevention and treatment in children, young people and adults at risk of or who have a pressure ulcer. European Pressure Ulcer Advisory Panel. The panel's goal is to provide relief for persons suffering from or at risk of pressure ulcers through research and the education of the public and by influencing pressure ulcer policy in all European countries towards an adequate, patient-centred and cost-effective pressure ulcer care. Factors that cause skin breakdown and pressure damage. A number of factors can cause skin breakdown and pressure damage. Pressure against the skin, limiting blood flow, which is essential to delivering oxygen and other nutrients to tissues. Without these, skin and nearby tissues are damaged and can eventually die. Limited mobility. For individuals with limited mobility, pressure ulcers often occur on bony parts of the skin, for example, the spine, hips, heels, and shoulder blades. Medical conditions that mean the individual is in bed for long periods, so when the skin rubs against bedding, it makes fragile skin more vulnerable to injury. Neuropathy or reduced sensation. If an individual cannot feel pain or pressure, they have an increased risk of developing pressure ulcers. Pain. This may make an individual reluctant to move. Too much pain medication will sedate patients and stop them moving. Shear. This can happen when two surfaces move in opposite directions. Decreased circulation. This may be due to smoking, diabetes, or high blood pressure. Poor nutrition and hydration. Aging. The inability to move independently. Being overweight or underweight. Moisture, so wet skin from urine, stools, or sweat. Learning difficulties. An individual may not understand instructions that could prevent pressure ulcers or may fail to respond to discomfort. Incontinence. This may cause skin damage that increases the risk of ulcers. Stages of pressure ulcer development. There are 4 main stages to the development of pressure ulcers. Stage 1. Closed wounds. Skin is painful, but there are no breaks or tears. The skin is reddened and does not lose colour if a finger is pressed on it. The skin temperature is warmer and a stage 1 sore may go in 2 to 3 days. Stage 2. The skin breaks away and forms an ulcer. The sore expands into deeper layers of the skin and looks like a crater, abrasion, or blister. At this stage, some of the skin may be damaged beyond repair or die. Stage 2 ulcers can heal within 1 to 6 weeks. Stage 3. The sore gets worse and extends into tissue beneath the skin and forms a small crater. Fat may be visible in the sore, but not muscle, tendon, or bone. Stage 3 ulcers may take several months to heal or may never heal, especially in those with ongoing health problems. Stage 4. The wound is deep and reaches into muscle and bone and causes damage. There may be damage to deeper tissues, tendons, and joints. Dead tissue may need to be removed to minimise further infection. Stage 4 ulcers may take several months to heal or may never heal, especially in those with ongoing health problems. In stages 3 and 4, tissue damage may mean there is little pain. If injuries progress, there can be serious complications, for example, infection of the bone or blood. Please pause the presentation here and complete worksheet for Unit 003, Learning Outcome 4, Worksheet 1 and Worksheet 2.